Well, a breast cancer diagnosis can be devastating to an individual and to family and friends. And while the race is still on to find a cure, no cure has been discovered. But there are new ways to screen for and detect breast cancer early, and many doctors believe that early detection can and will save thousands of lives. Joining us this morning to talk about the benefits of screening and early detection is Dr. Kurt Tower, an oncologist with the West Clinic in Memphis, Tennessee. He's here as part of our Hear Us Roar Healthy Living Corner, a partnership we share with Women Magazine. Welcome to the show, Dr. Tower. Good morning to you.
Thank you. Thanks for having me.
It is the talk that I hear all the time, the talk about early detection. And you just heard me say that many doctors believe it can save thousands of lives every year. How exactly can early detection help save lives?
One of the things about cancer is that the bigger it gets, we think the higher the risk is that the cancer can spread. So if you catch it earlier, you decrease the risk of it being able to spread. So early detection really does make a big difference. It also makes a big difference because when it first spreads, there's not very much to spread. And so it's easier for the chemotherapy or for the hormonal therapy in the case of breast cancer to kill those cancer cells before they set up shop and cause problems. And
so when we say early detection, what exactly do we mean in terms of methods, how effective those methods are? Is there any new technology?
Well, there are some new technologies. The standbys are mammography and ultrasound, which have been around for a long time, but even mammography is now digitalized and has come into the modern age. But we have MRI scans of the breast now that can tell us a lot, and we can do some pre-screening of the patients even before they get to the imaging by trying to find out what their risk factors are, whether they have a family history of breast cancer, whether their whole makeup of their lifestyle, those kinds of things can increase their risk of developing breast cancer.
And so do all women then need to utilize these detection methods? And if so, when and how often? I think that's a very important point to make because I don't think women really know how often they should go in.
Well, they should go in certainly for their mammography. They should go in every year starting at age 40, unless they have a higher risk, and then they might go in at age 30 or 35, and that would depend on their genetic makeup, but certainly every year at age 40.
How would you, Dr. Tower, define a high-risk patient? And let me just give you a little bit of personal history because my mother's mother died of breast cancer when she was 39 years old. And so I'm wondering in terms of the history in my own family, and would I be defined as a high-risk patient? And so how would somebody know that they're at risk of developing breast cancer so that they know to utilize these screening methods in a timely manner?
Well, you do have a family history of breast cancer, but your risk is not as high as it would be as if you had a first-degree relative. If you had a great-grandmother that had breast cancer, if you had been your mother or your sisters, then we would have a much higher degree of risk. So you look at the factors of the families and how close the relatives are and those kinds of issues before you really decide who's high risk and who's low risk.
And so what about the controversy over screening for breast cancer now? Because the change in early age screening for mammogram or yearly screenings has gone from 40 to 50, and it sounds like these new recommendations are contrary to what you're talking about this morning.
It really is controversial because the controversy goes around the fact that there are a lot of mammograms that are done from age 40 to 50 that don't really pick up anything, and you do have that radiation exposure. But the point is, if you catch that cancer early, you can really have a better chance of saving that woman's life. So I think it also is a financial question, unfortunately, because you save a lot of dollars if you don't start doing mammograms till age 50 from age 40. So I think it would be unfortunate for us as society to decide to not start doing mammograms at age 50 just for a financial reason. I think there really is good medical reason to start at age 40.
You know, one of the things I'm surprised at and just a little frightened by is there seems to be more and more women who are being diagnosed with breast cancer. Are there ways to prevent breast cancer, and have any studies been done?
It's very hard to think about prevention of breast cancer. We know that there's a huge genetic component, and you can't choose your parents, unfortunately, but there are lifestyle changes. It really is controversial about where diet is in this, you know, because if you look at the Asian diet of Japanese women that don't have as high incidence of breast cancer. Is it diet alone? Is there something else in their society and their culture that makes a difference? And so it's very hard to know about how to prevent breast cancer.
Well, I think it's very, very interesting because some studies even suggest that physical activity can help. And so it's sometimes difficult for women to know exactly what to do. What would you say to women who are concerned this morning or feel like, I'm not really sure what direction I should go in?
Well, I think what you should do is understand your own family history. And then I think the thing that every one of us can do is we can eat the best diet we can get and exercise and get ourselves in the best possible shape. Those are really the two things that you can do aside from change your parents, which is not possible. But those are the two things you can do to really fight your chance of developing any kind of cancer, breast cancer as well.
Wonderful. I have to tell you some wonderful information this morning, and I think that you've helped save some lives by just being here and sharing this information with our viewers. So thank you so much, Dr. Tower, for being here.
Great. Thanks.
Absolutely. And if you'd like to learn more information about early breast cancer detection and screening, just check out the website. It's cancerconnect.com. And if you like what you've seen here today, keep watching The Balancing Act for more great information from our Here is Your Healthy Living Corner.